Hello everyone, welcome to another video. So in today's video we'll be talking about tuberculosis, and in the last video we treated the topic poliomyelitis. So when we're looking at tuberculosis is a serious infectious disease that mainly affects the lungs, although it can affect other parts of the body, but it mainly affects the lungs. Like, it can affect other parts like bones, it can affect the brain, the kidney, the lymph nodes, and it can also affect the spine. So tuberculosis, it is caused by a slow growing bacterium known as Mycobacterium tuberculosis, and this Mycobacterium tuberculosis, it spreads from person to person through tiny droplets in the air when an infected person coughs, or an infected person sneezes, or even just speaks, and the droplet comes out from the mouth. So despite being a preventable and treatable disease, tuberculosis remains one of the leading causes of death from a single infectious agent globally. And there are two forms of this tuberculosis. So there is latent tuberculosis, that is, the bacteria is present in the body, but the immune system keeps them inactive, and the person usually has no symptoms and is not contagious. Then we have active tuberculosis. So in active tuberculosis, the bacteria multiplies and causes symptoms, and the person is contagious and can spread the disease. So looking at the background of this condition, so tuberculosis has existed for centuries, and it was historically known as consumption because of the weight loss and the physical wasting it caused. So it continues to be a major public health concern, especially in low income and middle income countries where their healthcare access is limited. So usually tuberculosis thrives in environments with overcrowding, environments with poor ventilation, malnutrition, and weak healthcare systems. So people with weakened immune systems, they are more likely to develop the active form of tuberculosis, and this includes individuals with chronic diseases such as HIV, diabetes mellitus, kidney disease, or people with malnutrition. So tuberculosis is also a notifiable disease, meaning health professionals, they must report diagnosed cases to public health authorities to prevent the community spread of this condition. So looking at the signs and symptoms of this tuberculosis, so tuberculosis, it affects many systems, so symptoms may vary depending on the part of the body that is affected. Like I said, it mainly affects the lungs, but it can affect other parts of the body. So in pulmonary tuberculosis, that is tuberculosis that affects the lungs, there could be a persisting cough lasting more than 2 to 3 weeks, then coughing up of blood or mucus can also follow, then chest pain, especially with deep breathing or coughing, then unexplained weight loss, fatigue and weakness, fever, night sweats, and loss of appetite too. Then in cases of extra pulmonary tuberculosis, these tuberculosis that affects other organs besides the lungs. So for lymph node tuberculosis, we will see symptoms like painless swelling of the lymph nodes, often in the neck. Then for spinal tuberculosis that is affecting the spine, we will see symptoms like back pain, stiffness, possible neurological symptoms if the spinal cord is compressed. Then for tuberculosis meningitis, we will see symptoms like headache. As tuberculosis has penetrated the CNS, so we'll see symptoms like headache, stiff neck, confusion, sensitivity to light. Then for kidney tuberculosis, that is tuberculosis affecting the kidneys, there will be presence of blood in the urine, frequent urination, and flank pain. So looking at the clinical presentation, a typical patient with tuberculosis may present with chronic cough, that worsening chronic cough lasting more than 2 weeks, then weight loss, and visible signs of wasting, like the person is losing weight, then fever, often low-grade fever, and fever that is usually more noticeable in the evening, then this presence of this drenching night sweats that require changing clothes or bed sheets, then coughing up thick mucus, sometimes mucus that is mixed with blood, and then chest discomfort or sharp pain when breathing. And then the patient might also tell you that, okay, they've had a recent close contact with someone who has tuberculosis, because this is a contagious disease. So in some cases, especially in children or those with weakened immune system, like I said before, those people that have HIV or diabetes mellitus, so the disease may present more subtly or with signs in other organs. Now, looking at the etiology of tuberculosis. So tuberculosis is caused by a bacterium known as Mycobacterium tuberculosis, and this bacterium is airborne and is spread through droplets released from the infected person when they talk or sneeze or when they cough. So once these droplets, once inhaled, the bacterium reaches the lungs, where it may remain inactive in the latent tuberculosis, or it becomes inactive tuberculosis, and it causes the disease. So in people with strong immune system, the body is often able to ward off the bacteria in structures called granulomas, preventing them from spreading. But in cases where the person has a weak immune system, they don't really have this fighting chance. So that's why people with weakened immune system are at higher risk of getting this tuberculosis. So that brings us to the risk factors now. So several conditions and lifestyle factors increase the risk of developing this tuberculosis. Like I said, number one, weakened immune system due to HIV, diabetes, kidney failure, organ transplantation, then malnutrition too. If you're not getting the necessary nutrients that you need, it puts you at a high risk of getting this infection. Then living in overcrowded or poorly ventilated environments and having close contact with someone with active tuberculosis. Then use of tobacco or excessive alcohol is also a risk factor. Then healthcare workers that work in the hospital that are exposed to these patients are also at risk. Then lack of access to proper health care, and also traveling to regions or just residing in regions that have high rates of tuberculosis. Then looking at the anatomy and physiology. So when we look at the lungs are the most commonly affected organ in tuberculosis, and the bacterium enters through the respiratory tract, reaching the alveoli, which are basically tiny air sacs responsible for gas exchange in the lungs. So in a healthy individual, immune cells known as macrophages, they try to contain this infection, and they form something known as granulomas, which are tight clusters of immune cells around the bacteria to isolate it. So in cases where the immune system fails, or in cases where the person has a weak immune system, so the immune system will fail to contain this bacteria, to fail to form the granulomas that will isolate it, and because of this, the bacteria will spread to nearby lung tissues, or it will travel through the bloodstream to other organs such as the brain, kidneys, bones, or the lymphatic systems. So that is basically what happens when the person has a weakened immune system, it makes it easier for the bacteria to reach other organs and just penetrate other places in the body. So looking at the pathophysiology, so like I said, the first is the entry of the bacteria. So Mycobacterium tuberculosis is inhaled into the lungs and it reaches the alveoli. Then there's the initial immune response. So the initial immune response is gotten from the body's macrophages. They are trying to destroy the bacteria, but Mycobacterium tuberculosis has special mechanisms that allow it to survive inside these cells, so it can stay latent. So granuloma formation is next. So the body creates this granuloma to trap the bacteria and prevent them from spreading. So latent tuberculosis, so the bacteria will remain dormant in these granulomas, and here the patient usually has no symptoms. Then reactivation can occur. So if the immune system weakens, the bacteria may break out of the granulomas and multiply and start affecting other organs and cause the active disease. So the stay of the bacteria in this granuloma depends on how strong the immune system is. So once there's a slight crack, once there's a slight, like once the immune system just becomes weak, there's a high chance of this bacteria reactivating. So after the reactivation, then there's tissue damage. So with the reactivation, we now have active tuberculosis, and in active tuberculosis, the bacteria destroys the lung tissue. It causes cavities and bleeding, which appear on chest scans, and this often leads to the coughing of blood that is seen in the patient because of the destruction of this lung tissue. So looking at the diagnosis, a proper diagnosis is based on history, physical examination, laboratory tests, and imaging. So clinical evaluation, like persistent cough, night sweats, like just general complaining of these symptoms, and having a history of the exposure. Then laboratory tests too, like microscopic examination of the sputum for the specific bacteria, then sputum culture to grow and confirm the bacterium, although this may take several weeks. Then there's something called tuberculin skin test, which is also called Mantoux test, so it can be done too. And then some blood tests like interferon gamma release assays, and other gene-based testing too. Then imaging, like chest radiograph to look for signs of cavities or enlarged lymph nodes. Then in cases of extrapulmonary tuberculosis, that is tuberculosis that has affected other tissues besides the lung tissue, so biopsy can be done, a biopsy from or aspiration from the affected organ, and then imaging like CT scans or MRI scans can be done too. So looking at other conditions that could mirror this tuberculosis, that is differential diagnosis. So lung cancer, then we have chronic pneumonia too, and chronic obstructive lung disease. So these conditions could also mirror the same symptoms that we see in tuberculosis. Then also HIV related lung infections too. So for the management or the approach considerations of this tuberculosis, so tuberculosis, the treatment requires multiple medications over a long period to completely clear the infection and prevent resistance. Usually the treatment is done for 6 months, and the standard treatment involves 2 phases. So it involves the intensive phase, that is the first 2 months out of these 6 months, which involves a combination of 4 antibiotics. I would break it down. And then the continuation phase, which is done in the next 4 months, and it involves a combination of 2 antibiotics. So the patients, they must be, when they are in this treatment, they must be monitored regularly for side effects and response to treatment, and they should be educated on the importance of completing their full course. Not they will just start and they will just be like, oh, I can't go. So they should be educated on completing their full course. For the treatment of tuberculosis, so it requires a long, well-structured course of multiple drugs, because Mycobacterium tuberculosis is slow growing, and it can hide within macrophages, and it has a lipid-rich cell wall, making it naturally resistant to many antibiotics. And this Mycobacterium tuberculosis can also develop resistance, which is why it's very important for the person to complete their dosing regimen, and because it can develop resistance when treated inadequately or with monotherapy. That's why we use more than one antibiotic, and that's why we have different phases when we're treating this condition. So looking at the standard first line treatment, that is for phase 1, that is the intensive phase, that is the first 2 months out of the 6 months. So usually it involves 4 antibiotics. Like I said before, it involves isoniazid, rifampicin, pyrazinamide, and ethambutol. So these drugs, they are often abbreviated as HRZE, and they are given in the first 2 months. Then for the continuation phase, that is the next 4 months, after the 2 months, the treatment continues with 2 antibiotics. It continues with isoniazid and rifampicin, and the total duration is 6 months for drug-susceptible pulmonary tuberculosis. So looking at why we give each of these drugs, like for example, isoniazid, it inhibits the synthesis of mycolic acid, which is an essential component of the bacterial cell wall of this Mycobacterium tuberculosis. So it's highly bactericidal to the actively replicating bacilli. So it is responsible for rapid killing of the bacterium in early therapy. Then for rifampicin, so rifampicin targets the DNA. It targets DNA-dependent RNA polymerase, blocking transcription. So it's also bactericidal and is a sterilizing agent which kills dormant bacteria, critical for preventing the relapse of this tuberculosis. Then for pyrazinamide, which is the 3rd antibiotic that we use in the intensive phase. So pyrazinamide disrupts the membrane transport and energy production at the acidic pH inside the macrophages. So it is also a sterilizing agent that is effective against these dormant bacilli in acidic environments, that is inside the macrophage where the bacteria is trapped. Then ethambutol, it inhibits the arabinosyl transferase, which is necessary for cell wall synthesis. So this ethambutol is bacteriostatic, and it helps to prevent the resistance to other drugs in the initial phase. So basically all these medications, they are given orally, and when we are giving isoniazid, we are typically meant to add pyridoxine, that is vitamin B6, to prevent peripheral neuropathy. And when we are giving this other, just like pyrazinamide, we have to monitor for liver enzymes because it's hepatotoxic. And then for ethambutol, we have to monitor the visual acuity and color vision because it can cause optic neuritis. It can affect the eyes. So there's something called fixed dose combinations. So to improve adherence, and reduce pill burden and minimize resistance risk. So there's fixed dose combination tablets that are widely used for this tuberculosis, especially in national tuberculosis programs. So these fixed dose combination, they usually contain a combination of these 4 antibiotics, and they make sure dosing is adjusted, and dosing is adjusted based on the weight. So when we are giving these combinations, we have to monitor like the for the vision, we have to monitor for the liver function and the adherence, that is making sure that the patient is regularly taking these drugs, and also manage side effects that may occur. And this usually when we are giving this medication, this combination to pregnant women, we need to monitor them closely, and we have to avoid giving streptomycin to pregnant women. And in children, we give short course regimens. So that is it for the treatment of this tuberculosis. So now looking at the non-pharmacological support that we could give. So nutritional support could be given to address the weight loss, because there's significant weight loss in tuberculosis. Then, like I said before, monitoring and treating side effects that can come with the dosing regimen. Then management of coexisting conditions, if there are other coexisting conditions, giving emotional support, and direct observation to ensure adherence. And then for prevention of this tuberculosis, there is a vaccination with Bacillus calmette-guerin, which is given as birth in many countries. And then early detection and treatment of the cases, and screening and preventive treatment for people that are in close contact with tuberculosis patients. And then some infection control measures in healthcare and community settings. And then just having improved ventilation and improved nutrition is the best prevention for this condition. Then when we're looking at the prognosis, so with early diagnosis and with full treatment, majority of people with tuberculosis, they recover completely. But without treatment, tuberculosis can be fatal. So everything just depends on the early diagnosis, the right treatment, and following the right dosing regimen. So if the treatment is not completed, there's a high risk of drug-resistant tuberculosis, which is much harder to treat. So that is why it is very important to complete the dosage, and that's why fixed dosage combinations were created, so to reduce the pill burden and everything, and to be easier to take the medications. And then in some cases, there could be permanent lung damage and scarring in some very rare cases. And people with weakened immune systems, they are at a greater risk of poor outcomes, or at a greater risk of this tuberculosis reactivating later. So it all depends on like having a strong immune system and your body being able to fight off this infection, because at the end of the day, it's a bacterial infection. So that is it for tuberculosis. Thank you.